Hello, everyone. How are you doing today? This is Denise 4 coming to you today with some information on bleeding in between periods. Okay, um, let's get started here. Okay, vaginal bleeding in between periods. Okay, what is vaginal bleeding between periods? Abnormal uterine bleeding is any vaginal bleeding that occurs between periods. This is also called intermenstrual bleeding, spotting, and metagoria. I think I'm saying that correctly, if I'm saying that correctly. You should see your doctor if you have abnormal vaginal bleeding. The cause of bleeding could be serious and should be determined. You should seek immediate medical help if pain, dizziness, fatigue, or fever occur in addition to abnormal vaginal bleeding. Vaginal bleeding between periods is also called intermenstrual bleeding, spotting, and metagoria. When bleeding occurs between normal periods, there are many possible causes. While some causes may be easy to treat, others can indicate a serious underlying condition, whether you notice spotting or heavier bleeding in between periods. It's important to see your doctor for testing, diagnosis, and treatment options. Potential causes of bleeding between periods include a growth in the uterus or cervix, stress, a change in medication, a miscarriage, vaginal dryness, a hormone imbalance, or cancer. Causes of vaginal bleeding between periods. Bleeding between periods isn't a normal part of the menstrual cycle. The average cycle lasts 21 to 35 days. Normal vaginal bleeding, also known as your period, can happen for a few days to a week. Any bleeding outside of this is considered abnormal and can be caused by a variety of factors, which include hormonal imbalance. Estrogen and progesterone are the two hormones that regulate your cycle. You may have spotting if they get out of balance. Dysfunctional ovaries, thyroid gland problems, and starting and stopping birth control pills can also affect your hormone balance. It should be noted that when starting any type of hormonal contraceptive, abnormal bleeding is common during the first 3 months, according to the National Health Services of the United Kingdom. These contraceptives include birth control pills, intrauterine device, I'm sorry, I don't know how to pronounce that, contraceptive patch, contraceptive implant or injection, pregnancy complications, uterine fibroids, infection, which means it could be a sexual transmitted infection, vaginal douching, intercourse, pelvic inflammatory disease, which is marked by inflammation of the reproductive organs leading to scarring, cancer, which is leading commonly a cancer of any of these organs can cause bleeding, the cervix, vagina, uterus, ovaries, rare causes. Okay, if you want to know more about or read on your own about the bleeding in between periods, I will also put the link to this page from Healthline on the bottom of this video. And also, if you'd like to know more info on how to have a better experience with your monthly period, please go to the website in the description below, and it will you will find out more information on how to have a better experience with your monthly period. Until the next video, thank you very much for watching, and also have a better period, and also have a blessed day, and I will see you on the next video. Thank you.